Yo guys, welcome to our channel. The channel is Nazvin. If you have not been around, welcome back. We have many videos. Nowadays we are doing a video each day, and we're getting new information. We're getting our viewership is going viral. That's what we always want our channel to get to. Kindly for the support, we have our details in our description, how you can reach us and also get to shares. If you have your products for promotion, we're also there so that we can always agree on the way forward. So guys, my name is Vincent. This is where we get to share matters medical in a simple language where we don't need to use a lot of medical jargon. That's why you don't need to be a medic to understand this kind of information. So guys, welcome. Today we're going to talk about something very sensitive, and today we are going to talk about the 12 facts about the penis. 12 facts about the penis. That's our topic for today. So, and there are going to be 12 interesting facts about it. And number 5 will surprise you, but I'm going to start with number 1. We talk about number 1 is size variability. And when we talk about the size variability, we are talking about they vary in size among men. The average erect penis length is about 5.16 inches, or that is 13.12 centimeters, while the average flaccid length is about 3.6 inches. We're talking about 9.16 centimeters. The average erect penis length is about 5.16 inches or 13.12 centimeters, or while in the average flaccid means when it is sleeping in quotes, the length is about 3.6 inches, that is 9.16 centimeters. The number 2 fact is the erection types. There are 3 types of erection which are known scientifically. We talk about reflexogenic, that's from physical stimulation. We have what we call psychogenic, which is related to mental stimulation, and also nocturnal, which we call occurring during the sleep. So the 3 types: the reflexogenic, which is called through physical stimulation. We have what we call psychogenic, which from mental stimulation. Also, we have what we call nocturnal stimulation, which occur during sleep. Number 3 facts about erection frequency. Men can experience multiple erections during sleep, typically during the what you call RAM, that is rapid eye movement. During sleep, you can find out what RAM means, is a rapid eye movement. We have phases in our sleep, so during rapid eye movement, we have this the experience of erection. It is common for healthy men to have about 3 to 5 erections in the night, so that's very normal. Number 4 fact is about penile health indicator. So regular morning erections, also known as morning wood, are signs of good penile health and a proper blood flow. Number 5, which I told you will surprise you, is about unique structure. The penis contains no bones. Sometimes some people believe it has bones, but today I want to clarify it doesn't have bones. But it has 3 cylindrical or sponge-like tissues that fill with blood during an erection. So that is the fact about it. And there are two corpora cavernosa and the corpus spongiosum, which really help these structure, the 2 structures which help the penis to erect like it has bones. On number 6 about circumcision. Circumcision is the removal of the foreskin. It's a common practice in many cultures, especially in Africa. But though we have our other tribes or some communities which don't practice it, and actually the wider population of the world, they don't practice circumcision. But here in Africa, mostly like in my community where I come from, that is Kisi, we practice it, circumcision. Also, we have other common tribes like Maasais, they also practice it. But I know in the European countries and Asia, there are special countries which don't practice it. Even in Africa, we have our neighbors who don't practice that circumcision, and so that is their culture. Normally, circumcision is a cultural thing more than a medical thing, and also it's a religious thing more than a medical thing. So sometimes also, unless it's very necessary, especially the kids, sometimes we do circumcise the small kids, or someone can get circumcised because of other issues, like when you have difficulty in urinating, especially if you have your urethra placed wrongly. So there's that abnormality of the urethra, and the urethra is the pipe which gets water out from the bladder. So because of recurrent infection, and sometimes as a man, you may not be able to urinate properly, so that is when that circumcision is introduced. When we talk about Peyronie's disease, Peyronie's disease, this is a condition involving the development of fibrous scarred tissue inside the penis, causing curved and painful erections. So sometimes we have that abnormal formation of the penis, where it is curved, and we call that Peyronie's disease. So, and it is very normally gives one painful erection and also curved penis at the end of the day. The average erection time, that's another fact. The duration of an erection can vary widely. On average, erection can last from a few minutes to around 30 minutes during the sexual activity. Number 9 is about sensitivity. The glands or the head of the penis is highly sensitive and also contains highly concentrated of nerve endings, making it one of the most sensitive area of the body. So the head or the gland of the penis is the most sensitive area because of the supply of the nerves. So it is a highly sensitive part of the male body. Number 10 is about blood flow. When we talk about blood flow, we're talking during erection, about 130 milliliters of blood is required to fill the erectile tissues. The ones I mentioned above, we're talking about the corpora cavosa and corpus spongiosum. So when we talk about the blood flow of the 130 milliliters of blood is required to fill the erectile tissues, the penis requires a strong and healthy cardiovascular system for proper functioning. So when your cardiovascular or your heart and also your circulatory system is healthy, your penis is likely to function very well unless there are other underlying issues. When we talk about also what you call erectile dysfunction, kindly if you have not watched about erectile dysfunction, I did a video previously. It's a very common condition which affects most of the men, and also sometimes it is reversible depending on the level of it and also the cause of it. So what you call ED or erectile dysfunction is the inability to achieve or maintain an erection sufficiently for satisfactory sexual performance. It can be caused by physical factors such as diabetes, cardiovascular disease, or psychological factors such as anxiety and also stress. Number 12 is very also interesting. We talk about the penile fracture. Although there are no bones in the penis, it is possible to experience a penile fracture. So how do you fracture if you don't have a bone? They occur when the tunica albuginea or the fibrous covering of the corpuscle cavernosum is ruptured due to trauma to the erections. Immediate medical attention is required. Actually, the penile fracture is a very bad emergency, especially when you have it occurs when the tunica albuginea, that is in Latin, so what we call the fibrous covering of the corpuscle cavernosa ruptures due to trauma. And this can be maybe rough sex and also maybe other issues which can cause it to rupture, and it is a very bad emergency because it can lead to death. So understanding these facts about the penile health and awareness of potential issues may require, and also it guides you to know what requires medical attention and how you are supposed to manage some special things about it. So managing penile health involves things like lifestyle management, medical management, sexual health, and also awareness and education. They are very key, and also avoiding penile trauma is also another aspect. When we talk about lifestyle management, we're talking about healthy diet is number one. And if you have seen most of our videos, we're talking about diet. Diet is a very key component in our health. So healthy diet is very key, where we talk about balanced nutrition. So consume a diet rich in consume a diet rich in fruits, and also vegetables, so that you may find whole grains, lean proteins. We talk about healthy fats to support overall health, and also including cardiovascular health, which is crucial for erection. So drink plenty of water to maintain good blood flow and also overall health. When we talk also about regular exercise, we talk about cardiovascular exercise. Engage in regular aerobic exercise such as walking, running, or swimming to improve the cardiovascular health and also blood flow. So pelvic floor exercises, especially when we talk about the Kegel exercise, to strengthen the pelvic floor muscles, which can improve erectile function and also urinary control. Healthy weight is also another aspect where weight management, maintaining weight, healthy weight is a key thing, guys, where you're going to reduce the risk of conditions like diabetes and hypertension, which can affect the penile health. Avoiding harmful substances. Here, I don't leave to mention about quitting smoking. Smoking can damage blood vessels, very obvious, and reduce blood flow to the penis, leading to erectile dysfunction. Limit alcohol intake, because this can impair erection function. Consume alcohol in moderation. That is the advice. Avoid recreational drugs such as marijuana, because they can negatively affect the sexual function and also the overall health in Jugu. So stress management is very key. So stress management, stress reduction is a very great component, where you get to practice stress reducing activities such as yoga, breathing exercises to manage stress, which can impact erectile function. Very key also is about sleep, where you need to adequately sleep to maintain overall health and hormonal balance. Medical management, we talk about regular checkups, where routine exams are very key. Visit a healthcare provider regularly to routine checkups to monitor the overall health and address any concerns related to penile health. Manage chronic illnesses. Diabetes and hypertension especially should be put in place, in control. Also, lifestyle changes and regular monitoring are very key. Cardiovascular health, monitor and manage cardiovascular health as heart disease and also other cardiovascular issues which impact the erectile function. Medications and treatments. Erectile dysfunction. If you're experiencing erectile dysfunction, consult your healthcare provider. Treatment may include oral medications such as sildenafil and also tadalafil for vacuum devices and also penile injections. And on pioneal disease, we seek medical advice for management of pioneal disease, for treatments which may include medication, physical therapy, also surgery can be included at the end of the day. Hormonal therapy is also another approach, where the testosterone levels are adjusted accordingly. Because the search has reduced the libido or erectile dysfunction, consult with your healthcare provider for evaluation and potential hormonal therapy. On the sexual health, we're talking about safe sex. Protection is very key. Use of condom to prevent the STIs, which can affect the penile health. Regular screening. Get regular screening for STIs and other infections. Communication. Partner communication is key. Maintain open communication with their sexual partners about sexual health and also preferences to ensure health and satisfying sexual relationship. Awareness and education is also another key, where self-examination, regular checkups, perform self-examination to detect any changes or abnormalities in your penis, such as lumps, sores, and also unusual discharge. Seek medical advice if any of those are detected. Education is another key, where you stay informed about it. So stay informed about the penile health and common issues that can affect. If understanding potential problems can help in early detection and treatment. Avoiding penile trauma is also another very key thing. Number one is about safe practice. Protective gear. Use protective gear when engaging in sports or activities that pose a risk to injure your genital area. So safe sexual practices. Engage in safe practices to avoid excessive bending or trauma to the penis, which can cause injury or penile fracture. Managing the penile health requires a holistic approach that includes the lifestyle choices, also regular medical care, and also awareness of potential issues. By following these guidelines, men can maintain good penile health and also prevent complications at the end of the day. So, and address the problems promptly, regular consultations, and also with the healthcare providers are very essential to monitor health and also making very informed decisions over the same. When we talk about the complications related to penile health, can arise from various factors such as lifestyle choices, medical conditions, and also injuries. Being aware of these potential complications can help in early detection and also management. And here are some of the common complications which come about. Number one, and which is very common, is when we talk about what we call erectile dysfunction, or ED. ED is very common, and here we have inability to maintain an erection or sufficient for sex. Yeah, yes, penile is also number two, penile disease. And when we have symptoms develop of this fibrous scar inside the penis, causing it to curve and also have those painful erections is also another thing. So this may be linked to trauma and also genetic factors. When we talk about the penile disease, so rheumatism also can be another complication where you have prolonged and painful erection lasting more than 4 hours without sexual arousal. This can be caused by blood, especially people with sickle cell anemia. We talk about medications such as erectile dysfunction drugs and antidepressants can cause also this. Trauma and also substance abuse can be the cause of this. Penile fracture is also another complication where we have sudden pain, swelling, and hematoma, bruising after the trauma to erect penis. Causing trauma can be excessive bending during the sexual activity at the end of the day. Phimosis and paraphimosis is also another complication. When we talk about phimosis, we're talking about inability to retract the foreskin over the gland penis, especially those who are not circumcised. And when we talk about paraphimosis, the symptoms include the foreskin becomes trapped behind the gland and cannot be returned to its normal position, causing the swelling and also the pain. This can be caused by infections, inflammation, injury, and also congenital conditions. Number 6, about sexually transmitted infections as a complication. They vary in infection. We talk about sores, we talk about or penile. We have warts, we have discharge, we have pain during urination. So this can be caused by unprotected sexual contact with an infected partner. What we call balanitis also is another complication where we have inflammation of the gland leading to redness and also swelling and pain. So poor hygiene can be the cause of this. Infections which are fungal and also bacterial or an allergic reaction can cause what we call balanitis. Penile cancer is also another complication. Lumbar sores on the penis. Actually, we have penile cancer, and it's not very interesting. We have unusual discharges and bleeding. So risk factors include the HPV or human papillomavirus, smoking, and poor hygiene on the genital or penile health. Hypogonadism is also another complication where we have low testosterone levels resulting in reduced libido and also erectile dysfunction, fatigue, and a decreased muscle mass. This is caused by testicular injury, genetic conditions like aging, and certain medications, such as when one is on chemotherapy or radiotherapy, they can cause what you call hypogonadism. Urinary tract infections, which pain or burning during urination, frequent urge to urinate, cloudy or strong smelling urine, bacterial infection in the urinary tract are the cause of this. Managing and preventing the complications is very key. Sometimes we give oral medications like sildenafil and teledanafil, like quitting smoking, psychological therapy, vacuum erection devices, penile injection, and also surgery. So those are the basic way in which one gets to manage this. For penile disease, the main management for this is early treatment of the penile trauma and also managing the underlying condition. For rheumatism, is immediate medical treatment to relieve the erection and also medications to reduce the blood flow or surgical interventions if very necessary. Also prevention avoidance of drugs, substances that can trigger rehabilitation, and also proper management of underlying conditions. Penile fracture management, emergency medical treatment often require surgery to repair the damage. So practice safe sex and also avoid excessive force or bending of the erect penis. Phimosis and paraphimosis. So topical creams is very key. Manual stretching exercise, circumcision for severe cases. Good hygiene and early medical intervention can arise at that particular point. Sexually transmitted infections, appropriate treatment of antiviral medications or antibiotics depending on the cause of the infection. Also use of, for prevention, part of it, use condoms, get regular STI screenings, and also maintain monogamous relationships. Balanitis, good hygiene, antifungal, antibacterial medication, and avoid irritants can really manage it. So proper hygiene practices and avoiding known allergens or irritants. For penile cancer, the management of it is most of the time is surgery, radiotherapy, chemotherapy, depending on the stage of the severity. Also, HPV vaccines, good hygiene, and regular medical checkups is very key. What in hypogonadism, testosterone replacement therapy, lifestyle changes, and management underlying condition is very key. So on preventive part of it, regular monitoring of the testosterone levels, especially at the individuals with the risk of this. On urinary tract infection, antibiotics to treat infection is very key. Good hygiene, staying hydrated and urinating after sexual activity is a good practice. So guys, practice of safe sex, limiting sexual partners, communicating openly, hygiene and self-care, regular medical checkups, awareness and education, avoiding injury, medical interventions are very key in managing this. If you experience any unusual symptoms or changes in your penile health, such as pain, swelling, or difficulty in urinating, it is very important that you get to seek medical advice as early as possible. By adopting the preventive measures and maintaining the health lifestyle, you can significantly reduce the risk of penile health and also complications, and maintain optimal sexual function and overall well-being. So regular communication with the healthcare providers ensures that the concerns are addressed promptly and effectively. Guys, welcome. That's about our penile health and also the 12 facts about the penis. So guys, I want to welcome you to our next video. We love you very much, and welcome to our next video. Peace, guys.